A prostate cancer doctor says that 80% of prostate surgeries are unnecessary. Prostate cancer is a significant concern for men, being one of the most commonly diagnosed cancers in the United States. In 2023, approximately 299,000 men received a diagnosis of prostate cancer. Understandably, such a diagnosis can be frightening, I know, leading many to consider aggressive treatment options like the radical prostatectomy. However, it's crucial to understand the implications and necessity of this surgical procedure fully before making a decision. The reality of radical prostatectomy. While the prostatectomy can be life-saving for some, it's essential to recognize that it is not always necessary. Alarmingly, estimates suggest that up to 80% of prostatectomies might be avoidable. This statistic implies that around 72,000 men undergo this invasive surgery without a clear medical necessity every single year. Understanding unnecessary surgeries. Many forms of prostate cancer grow slowly and are unlikely to cause significant health problems during a man's lifetime. For these cases, active surveillance, which is the regular monitoring of the cancer without immediate treatment, can often be a safer and equally effective approach. If it's still accurate today that 80% of prostate surgeries are unnecessary, then men with prostate cancer face a very serious problem. Let's take a look at the financial implications, shall we? With 90,000 prostatectomies performed in the United States in 2023, this would mean that 72,000 men had unnecessary surgeries. With each prostatectomy costing approximately $42,000, that's a total of $3 billion. Of that total amount, urologists typically earn around $8,000 per surgery, amounting to $576 million for those unnecessary procedures. And let's take a look at the negative consequences of prostate surgery. Let's look at incontinence over the short term. Significant improvement within the first few months for most men, but 10 to 20%, or 9,000 to 18,000 men may experience persistent incontinence at 3 months post-surgery. With long-term recovery, about 5 to 15% of men, which is 4,500 to 13,500, experience long-term incontinence. And let's talk about erectile dysfunction, where you simply can't get it up. 30 to 60% of men, which is 27,000 to 54,000 men, may experience some form of erectile dysfunction after surgery, with rates increasing with age and other health conditions. And there are also infections to consider after surgery. Urinary tract infections are about 13 to 24% of men who develop UTIs after surgery. There are also surgical site infections, which occur in about 2 to 5% of prostate surgeries. And let's take a look at the most serious side effect of all, death. The 30-day mortality rate after prostatectomy is between 0.1% and 0.5%. So this is approximately 450 men who may die annually from complications related to the prostatectomy, with around 360 deaths potentially unnecessary. Based on this information, the decision to undergo a prostatectomy should not be taken lightly, given the potential risks and complications. Beyond mortality, the prostatectomy can have other severe side effects, including impotence, incontinence, which significantly impacts a man's quality of life. Now that you know the side effects, it is crucial for men diagnosed with prostate cancer to avoid rushing into surgery. Instead, please consider the following steps. Get multiple options. Consult with various healthcare professionals to understand all your options. Consider active surveillance. For low-risk prostate cancer, active surveillance can be an effective strategy. And weigh the risks and benefits. Understand the potential complications and quality of life impacts associated with the prostatectomy. And please stay informed. educate yourself about the nature of your cancer and the latest treatment options. So in conclusion, the exact percentage of unnecessary prostatectomies today would need to be determined by recent research and clinical data. While the 80% figure from Dr. Schultz in 2010 highlighted a significant issue, improvements in medical practice and technology have hopefully meant that fewer unnecessary surgeries are performed today. So it is crucial for patients to seek multiple opinions and consider all treatment options before proceeding with a prostatectomy.